Hey, welcome. Today, we're going to do something a little different. We're stepping into the role of a hiring manager for what might be one of the toughest jobs on the planet, replacing a natural tooth. Yep, we're going to hold a full-on job interview to find the perfect material for the gig. So, let's get right into it.
So, here's the situation. We've got a vacancy, and it's a critical one. A natural tooth is gone, and we have to find the absolute best replacement. So the big question is, what material out there really has what it takes to step up and fill this incredibly demanding role?
You know, when a tooth is lost, it's way more than just an empty space. It's a key position that affects literally everything. How you chew, how you speak, even the shape of your face. And the most common way we fill this vacancy is by bringing in a whole team of artificial teeth, all held together on something we call a denture.
So what exactly is a denture? Well, think of it like the office building where our new hire is going to work. You got the denture base, that's the pink part, kind of like the foundation that sits on the gums. And then you've got the stars of the show, the artificial teeth. And those are our job applicants today.
Okay, before we even think about hiring anyone, we need a really detailed job description. This is not a role for just any old material. The standards are incredibly high, and the list of qualifications, it's long, it's tough, and it has to be for a job this important.
So what are the absolute must-haves for this job? First off, our new tooth has to be a dead ringer for a natural one. The shape, the color, the way light shines through it, everything. It also has to be a great team player and bond perfectly to that denture base. And it's got to be lightweight, but also an absolute powerhouse, strong enough to handle all the grinding and chewing day in and day out without breaking a sweat. It's a tough gig, no doubt about it.
All right, we put the job posting out there, and two top candidates have emerged from the world of dental materials. Both of them have pretty impressive resumes, and they are both totally convinced they are the right one for the job. So, who's it gonna be? Let's meet our applicants.
In this corner, we have the modern challenger, acrylic resin, a super versatile plastic polymer. And in the other corner, the timeless champion, porcelain, a classic ceramic known for its amazing strength and good looks. Two very different materials going for the exact same job. First, let's see how they're made.
So, acrylic resin teeth start out as a simple powder, which then gets molded into that perfect tooth shape. But the real magic? The secret sauce is in that final step. The resin is highly cross-linked. Now, what on earth does that mean? Okay, imagine you have a bunch of loose threads. Now imagine weaving all those threads together into a super tight, dense net. That's pretty much cross-linking. It makes the tooth incredibly resistant to getting those tiny hairline cracks we call crazing.
Now, porcelain is a completely different story. It's shaped in a mold that's about 30% too big, on purpose. Why? Because when you fire it in a really hot kiln, it shrinks down to the perfect size. And here's where you see a huge difference. Porcelain won't chemically stick to the denture base, so they actually embed tiny holes or even little metal pins right into its base to give it a solid physical grip.
All right, we've gone over their resumes, we've seen how they're made, now it's time for the main event, the head-to-head interview. Let's see how our two candidates really stack up against that tough job description.
Okay, let's break this down. For attachment, acrylic resin basically fuses with the base through a chemical bond, becoming one solid piece. Porcelain, on the other hand, needs those little pins to literally get a mechanical grip. What about adjustability? Well, acrylic is a dream for dentists. They can easily grind it down for a perfect fit. Porcelain? Not so much. It's really rigid and hard to adjust. And when it comes to strength, porcelain is a beast at resisting wear, but it can be brittle. A sharp impact could chip it. Acrylic is tougher and less likely to fracture, even though it might wear down a tiny bit faster over many years.
Okay, now it's your turn to join the hiring committee. You've heard the pitches from both our candidates, and now it's time for a little skills test to help us make the final call. Let's see what you've learned with a quick quiz.
First question for you. Think back to our classic candidate, porcelain. How does it primarily attach to that denture base?
And the correct answer is C, using mechanical pins or holes. That's right, because it can't form that chemical bond, it relies on a physical anchor. Those little pins are absolutely essential for a secure fit.
Okay, next up, let's talk about our other applicant. We mentioned that special reinforcement that acrylic teeth get. Why is it so important for them to be highly cross-linked?
The answer is D, to make them resistant to crazing.
That internal net we talked about creates a super tough structure that prevents those tiny, damaging cracks from forming in the first place. It's a huge deal for their long-term durability.
And for our last question, let's jump back to porcelain's really unique manufacturing process. Why are those molds made so much bigger than the final tooth is supposed to be?
And the answer is B, shrinkage during firing. It's a classic technique for ceramics. You have to calculate exactly how much the material is going to shrink when it gets heated up, so you end up with a tooth that's the perfect size. Pretty neat, right?
So, who gets the job? Well, as we've seen, both acrylic resin and porcelain are fantastic candidates. They each have their own unique strengths, which means the best choice really depends on the specific situation. But picking the material is just the beginning of the story. There's so much more that goes into creating a perfect smile. And all of that, well, the remaining sections will be discussed in upcoming parts.
All right, welcome back. This is it, the final part of our deep dive into denture materials. Today, we are settling a really old debate. When it comes to the teeth in a denture, what's the better material? We've got the classic porcelain facing off against the more modern acrylic. Let's get into it.
So, let's just ask the question straight up. If you're getting a denture, which tooth material should you choose? We're going to figure that out by putting them head to head, looking at everything from how they look to how they hold up over time.
You know, first impressions matter a whole lot, so let's kick things off with aesthetics, how they actually look. I mean, when you're trying to create a natural-looking smile, both of these are pretty serious contenders.
At a quick glance, both of these options can look incredibly realistic. They come in a huge range of shapes, sizes, and shades, so you can match them to pretty much anyone. But if you're really splitting hairs, porcelain often gets a little bit of an edge. It's got this superior translucency that just mimics natural tooth enamel a tiny bit better.
So visually, they're super close. But what about how they sound? Yeah, you heard me right. A really common thing patients with porcelain teeth mention is this distinct clicking noise when they're talking or chewing. It's a small detail, sure, but it's something you'd probably notice every single day.
Okay, let's move on to what is probably the single most critical technical difference between these two, and that is how the teeth actually stick to the denture base. This connection, well, it's everything when we're talking about durability.
Acrylic teeth bond using something called a chemical union. The best way to think about it is like a weld, or maybe a really powerful glue. The liquid part of the denture base, the monomer, actually softens the surface of the acrylic tooth, and they literally fuse together. They become one solid piece. It's a true chemical bond.
Porcelain, on the other hand, is completely different. It can't fuse chemically with the acrylic base, so instead it has to rely on what we call mechanical retention. If you look at the bottom of a porcelain tooth, you'll see these little holes. They're called diatoric holes. The denture-based material flows into these holes and hardens, basically locking the tooth in place. It's less like glue and more like a peg snapping into a hole.
So here's the absolute key takeaway. Acrylic fuses with the base, while porcelain is locked into the base. One is a chemical marriage, the other is a mechanical grip. And trust me, this fundamental difference has huge, huge implications for how long that denture is going to last.
And here's exactly why that bond is so critical. Get this, a full 1/3 of all denture repairs are needed for one simple reason: a tooth popped off. That just goes to show you, getting this connection right isn't some minor technical detail, it's one of the biggest predictors of a denture's success.
Okay, so we've got aesthetics and bonding down. Now let's dig into the hard numbers. This is where the practical, real-world differences between acrylic and porcelain really start to jump out at you.
This table here breaks down the core physical properties of both materials. Don't worry about all the jargon. We're going to walk through what each of these numbers actually means for the dentist and, more importantly, for the person wearing the denture. Let's start with density.
First up, density. Look at that. Porcelain is literally twice as dense as acrylic. For the patient, that's a big deal. It means dentures made with porcelain teeth are going to be noticeably heavier in the mouth, and that can definitely affect comfort.
Now brace yourselves for this one. The difference in hardness is just staggering. Porcelain is 25 times harder than acrylic. Now your first thought might be, great, harder's better, right? More durable. But in dentistry, being too hard can actually be a major problem.
And here's why. First off, that extreme hardness makes it a nightmare for a dentist to grind and adjust the tooth to get the bite just right. When they do manage to grind it, it takes off the smooth, protective outer glaze. But maybe most importantly, while it's hard, porcelain is also very brittle. Think of a ceramic dinner plate. It's hard, but if you drop it, it shatters. It's much more likely to chip or crack under pressure than the tougher acrylic.
And finally, let's talk about how well they play with others, specifically the denture base. An acrylic tooth on an acrylic base is pretty much a perfect match. They expand and contract from hot and cold at about the same rate. But porcelain and acrylic, they're totally different materials. That mismatch creates stress in the base right around the tooth, which can eventually lead to tiny little cracks called crazing.
So after we've compared how they look, how they bond, and what the data says, a pretty clear winner starts to emerge for modern dentistry. Let's just wrap up why one of these materials has become the go-to choice.
You know, this quote from our source material just says it all, really. Even though porcelain has been around forever, acrylic has pretty much taken over the market. Its advantages in the clinic and in the lab have made it the favorite for dentists and technicians all over the world.
So let's recap the 4 big reasons acrylic wins this showdown. 1. It's tucker and way less likely to chip. 2. It's way more compatible with the base, which means less stress and fewer cracks. 3. It's just a breeze for dentists to work with and adjust. And 4. It still looks fantastic and gives a really realistic appearance.
Okay, that was a lot of info. So now it's time to put your knowledge to the test. We've got a couple of quick questions just to make sure these key ideas really stick with you. First question for you. What is the main way that porcelain teeth attach to a denture base? Is it A, chemical union, B, solvent bonding, C, mechanical retention, or D, thermal fusion? Take a second. What do you think? And the correct answer is C, mechanical retention. Yep, you got it. Porcelain relies on those little diatoric holes to create a physical lock with the denture base.
All right, one last one. Let's say a patient tells you their dentures feel heavy and they make a clicking sound. Which material are their teeth most likely made of? A, acrylic resin, B, porcelain, C, cross-linked polymer, or D, composite?
And the answer is B, porcelain. Those are the 2 classic tells, right? The weight from that super high density and that unmistakable clicking sound are dead giveaways for porcelain teeth. So we've seen how acrylic really rose to become the modern standard, solving a lot of the issues that came with porcelain. But, technology never ever stands still. And that leaves us with one final big question to think about. With acrylic so clearly on top right now, what's next? What kind of innovations are going to shape the next generation of denture materials?